There are over 100,000 ACL reconstruction surgeries performed yearly. Thanks to the advancement of surgical techniques and the development of evidence-based rehabilitation protocols, most ACL reconstructions do quite well. But when it comes to those looking to return to sport, the rates of success are surprisingly low. Over one-third of athletes do not return to sport within 2 years after surgery, and as many as 20% of individuals end up re-tearing either their reconstructed ACL or the ACL on the other knee. This can be attributed to several reasons, including premature return to sport, or due to the presence of persistent movement dysfunction not properly managed either prior to surgery or during post-surgical rehabilitation. In this video, we will discuss 5 keys to maximizing recovery after ACL reconstruction. Number 1. Delay surgery at least 3 weeks, but no longer than 6 months. ACL tears are season-ending injuries and require lengthy recovery times, so it is understandable that athletes feel pressure to receive surgery as soon as possible. But it is important to note that having surgery too close to the date of injury can actually negatively impact recovery. This is due to the higher risk of developing post-operative knee stiffness, also known as arthrofibrosis. Arthrofibrosis is a fibrotic joint disorder characterized by excessive collagen production and formation of adhesions that result in a very stiff and painful knee. This can significantly impact function and return to sport. A study reported that half of those who received ACL reconstruction 1 week after injury developed stiffness, while only 17% of those that underwent surgery 1 to 3 weeks after injury developed stiffness. None of the individuals in the study that received surgery greater than 3 weeks post-injury experienced any loss of mobility. However, waiting too long can also have consequences. Those who choose to delay surgery more than 6 months have been shown to have higher incidences of additional knee injury, including cartilage damage and meniscal tears. This was associated with the inherent instability in the ACL deficient knee, leading to increased strain through the other knee structures with higher level activities. Number 2, regain full knee range of motion pre-op and post-op as soon as possible. Knee range of motion pre- and post-surgery can also significantly impact post-operative outcomes. If managed appropriately, full knee range of motion is expected around 2 weeks from the date of injury and 4 weeks after surgery. Full range of motion is considered equal degrees of knee flexion and hyperextension compared to the other knee. The longer the knee lacks mobility, the greater the chance of developing arthrofibrosis. Symptoms of arthrofibrosis include walking with a bent knee, worsening pain, and warmth and swelling around the knee. Now, all of these symptoms are normal and expected after surgery, but they should resolve within a couple of weeks if managed appropriately. Mild cases of arthrofibrosis may be resolved with intensive physical therapy alone, but in cases of severe knee stiffness, manipulation under anesthesia may be required. This is when the doctor forcefully moves the knee while the patient is under anesthesia to break up the scar tissue. This can lead to further injury and inflammation. Not fun. So it is essential that knee range of motion is regained as quickly as possible. Number 3, utilize electrical stimulation early post-surgery to regain quadriceps control. Regaining control of the quadriceps muscle is another key component to ACL rehab. It has been shown that those who have more than 20% quadriceps weakness going into surgery experience persistent weakness as much as 2 years post-surgery. After surgery, it is very common for the quadriceps muscle to experience what is termed neuromuscular inhibition, especially in cases where the surgeon uses the patella tendon to harvest the ACL graft. Muscle inhibition is different than muscle weakness, which is related to the actual size of the muscle itself. Muscle inhibition is instead a neurologic issue that stems from impaired sensory processing within the knee due to post-surgical pain and swelling. This altered sensory processing results in a reduction in signaling in the spinal cord and brain, which in turn results in a reduced ability to actively control and generate power in the surrounding muscles. This can lead to muscle weakness that persists years after surgery despite following a formal strength program. To combat this issue, there is research supporting the use of electrical stimulation, which is a device that sends an electrical impulse into the muscle to improve its ability to contract. The use of electrical stimulation has been shown to be beneficial in addressing quadriceps muscle inhibition early on in the rehabilitation process, allowing individuals to progress to more advanced phases of rehab sooner. Number 4, follow a comprehensive, criteria-based rehabilitation protocol. A thorough performance assessment by a trained provider is critical to an efficient and successful return to sport in later phases of the rehabilitation process. There is no one test that has been found to predict injury or successful return to sport. Because of this, researchers suggest that utilization of several tests to assess a combination of flexibility, strength, and power, as well as quality of movement. These measures provide valuable information to guide rehab and assess readiness to return to sport. Prior to return to sport, it is expected that the athlete regains full knee range of motion, at least 90% quadriceps strength, and scores 90% or greater on hop tests compared to the other knee. For those who participate in sports that require quick changes of direction or sports with contact, it is suggested that individuals score closer to 100% on these measures. Those who fail to meet these criteria have been suggested to be at higher risks of injury and show reduced athletic performance. It is also important to consider psychological implications as it pertains to returning to sport. Fear of re-injury is the most common psychological barrier to rehabilitation progress following an ACL injury, and is associated with fear avoidance behaviors and stopping sport and recreational participation altogether. A study found that 20 to 45% of individuals reported that fear of re-injury was the reason they did not return to sport after ACL injury. Based on these psychological influences, it is suggested that providers assess fear of re-injury along with other physical measures when determining readiness to return to sport. Number 5. No return to sport prior to 9 months post-surgery. No matter how well an athlete feels or how good their scores are on physical and psychological assessments, there is no outpacing the rate of healing. Full healing of ACL reconstruction can take upwards of 1 to 2 years, and rushing back to sport can lead to significant chances of re-tearing. Athletes who return to strenuous sport before 9 months after reconstruction were shown to have a 7 times higher rate of second ACL injury. This re-injury rate was significantly reduced by 50% for each month return to sport was delayed until 9 months after surgery. After 9 months, there did not appear to be any additional reduction of risk. So again, no matter how good an athlete feels or how well they are moving, simply waiting 9 months can significantly reduce their risk of re-injury. Thanks for joining me on another episode of Physio Show. Make sure you like and hit that subscribe button to receive more physical therapy related content.